Hey everyone, OT Lifehacker here. Today is day 9 of my fieldwork in the acute care setting, hospital setting, in occupational therapy. And so this is fieldwork level 2 for future occupational therapy students, those interested in occupational therapy, and people just wondering what I mean by fieldwork level 2. That means that fieldwork is you are out there in the setting, you are out in the field. But level 2 indicates that I will be able, as a student, to have much more hands-on experience with the patient. So many of the other students have said it as it's almost, or it's pretty much, you are an occupational therapist. You are doing treatments, you are coming up with treatments and planning them and implementing them and documenting them, and you are also the one who's doing the chart reviewing because you have to know who the patient is, and you're doing the occupational profile, which occupational profile means that you're interviewing the patient to know about where they were before, client. You are interviewing the client to know what their baseline functioning was at home in their day-to-day life. Could they do bathing, showering, brushing their teeth, eating all by themselves? Could they do their IADLs, which is the instrumental activities of daily living, and that is the more complex things that we do, such as financial management and shopping, grocery shopping, making a list of the things you need, going to the store and finding the items, driving, all the more complicated stuff. That is more so your instrumental activities of daily living. And we often are working with occupational therapists and physical therapists. So us being occupational therapists, we may have speech therapy or physical therapy co-treatments, meaning we are doing the treatment or evaluation together with another therapist or someone else. And so when do the occupational therapists and physical therapists work together in the acute care setting? So this is dependent on the facilities, of course, and the insurance, billing for the facilities, the policies, and even state regulations might be an influence. I'm not so sure. If anyone knows about that, do comment below, please. And when you do OT and PT work together in acute care, in this setting that I'm currently in, it is when the case is complex. So we have 2, 4, 6. So we have about 6 reasons why you would do OT evaluation or OT and PT treatment together in acute care. So here are the 6 reasons. Here are at least 6 reasons. So 1 is when the treatment is complex, when the case is complex. So if the person has multiple comorbidities or multiple conditions that you're treating or have to be aware of, say for example they have heart conditions and they had brain surgery, and there's a lot of weakness throughout their body, and they also have that precautions for their say they had heart surgery, right? They are likely going to need a lot more assistance, physical assistance, lifting them and managing all the wires that are with them, the tubes, the equipment. And so it'd be best to have more than one person there, and very likely they're going to need OT and PT they're going to need both services. And then you have cognition. Are they able to think accurately, and are they aware, alert, and are they able to kind of essentially make decisions on their own? Are they very forgetful? Is their attention not great? Do they have trouble with divided attention or staying on task? So there's a lot of things to think about are they cognitively able to perform the activities and to learn what you are teaching them? And level of functioning. So what level of functioning means, for example, in occupational therapy, how much assistance do you need to provide them, or if needed to provide them? Say, for example, you have someone who, let's see, you walk into the room and you see that maybe they're putting a device in their mouth that isn't supposed to go there, then that can be alarm for the cognition that, oh, okay, something's a little up there. And then you also see that their arm is trembling and the other arm is stiff. They can't move that side of their body. They just had a stroke. Then you might need more assistance, because you might need someone to help support the person, and you might need to be careful. Will there be other issues that you have to think about when working with this patient? So this kind of all goes back to how complex is this person. And then how about their weight? How heavy are they? If they're pretty heavy and they need a lot of assistance, physical assistance lifting, you might need more support. You might need another pair of hands. How complex are their symptoms? So, for example, are their symptoms stable, or are they experiencing more trouble than usual? The impulsivity is a big one. Are they quick to do things without really thinking? So is safety a problem? Are they aware of what they're doing? Or are they just quickly acting and not thinking about it? So again, that's a big safety concern. And then the 7th one, that's right, I gave you guys a bonus, tricked ya. The 7th one is how many lines and tubes are connected to them. So I kind of said this in how complex is it. How many lines, tubes are connected to them, and how much medical equipment are they hooked up to. So again, they could be hooked up to the IV and have the heart monitor and have a catheter and have a bunch of other things, and so you might need more support. Now, especially if all 7 of these are there, you will very likely be safer to have someone there supporting you, having physical therapy there with you, or if you're a physical therapist, having an occupational therapist with you. All right, so that is the 7 things that I wanted to share about when do OT and PT work together in acute care. All right, bye guys. Thank you.